Someone who was one of the earliest to raise awareness at scale on the connection between diabetes and PAD is Mary Yost, co-founder and president of research and consulting firm, the SAGE Group. Her research is the most widely used and quoted in justifying increased medical and innovative attention for peripheral artery disease. The SAGE Group's diabetes method, which is believed to offer the most accurate estimates of the number of people with PAD, CLI, intermittent claudication, and asymptomatic disease, is used around the world and has had a profound impact on raising awareness about just how widespread this disease is, and has triggered more attention from the medical community on the diagnosis and treatment of this disease. Now, even more, her data has sparked new innovation, which has helped improve patient outcomes in the last nearly 2 decades. And most recently, her costs and consequences analysis of diagnosis and treatment options for PAD has led to a global movement to reduce the number of amputations and help people with PAD to live a better quality of life. For her nearly 2 decades of commitment and impact on PAD patient outcomes through her research, we are so excited to present the Weight of My Heart's Lifetime Achievement Award to Mary Yost for her unmatched efforts in diabetes and PAD awareness. Mary Yost, thank you so much, again, from the bottom of our hearts.
Thank you, Kim. I just want to thank you and the Weight of My Heart organization for this Lifetime Achievement Award, and I will show you the award. It's this very lovely heart with an inscription. And again, thank you so much. And I'm really honored to be a recipient of such an award. I'm also very pleased and encouraged that our research on PAD has achieved this type of recognition. Now, there's a really, really long way to go. We still have a very significant need for increased PAD publicity and awareness. And organizations such as the Weight of My Heart have a very important role in creating this publicity and awareness to the consumer. So the title of this presentation is PAD and CLI, Where is the Media? PAD, 20 years ago, we wrote that PAD was underestimated, underdiagnosed, and undertreated. And unfortunately, this statement still holds true today. We need more publicity and increased awareness of PAD and CLI, because without a change in this situation, patients will remain undertreated and inadequately treated. The result, excess patient morbidity and mortality will continue, amputations will continue, and a high economic cost. Remember that taxpayers foot the bill for this disease. Taxpayers foot the bill for the Medicare and Medicaid, and Medicare and Medicaid pay 70 to 80% of the bill for PAD. So these are our tax dollars. PAD is a highly prevalent disease. If you look at the US prevalence of chronic diseases, we see that at 21 million, PAD exceeds coronary disease. All cancers put together are 17 million. Alzheimer's, stroke. The only more prevalent disease is diabetes, and as we've heard, there's a very close connection between diabetes and PAD. Yet, even though this is a highly prevalent disease, we never hear about it. Where is the media? Where are the stories about PAD and critical limb ischemia? Furthermore, if we look at the economic burden of PAD, we see that PAD is one of the most costly, if not the most costly, chronic diseases. At $274 to over $500 billion, the cost of treating PAD exceeds the direct cost of diabetes of $237 billion, coronary artery disease of about $200 billion, and all cancers put together are a little under $90 billion. Once again, this is a very expensive, very prevalent disease. There are no stories on it. Where is the media? Where is the publicity about this disease? In 2013, seven years ago, Dr. Alan Hirsch called PAD a global pandemic. So that was 2013. And at this point, he wrote a commentary titled The Global Pandemic of Peripheral Artery Disease. It was a commentary on the Fowlkes article in which they first published the prevalence of worldwide prevalence of PAD at over 200 million. So back in 2013, this was called a pandemic. Yet, again, there was no publicity. There still is no publicity. So if we look at another pandemic and compare the two, if we compare the prevalence and the mortality of COVID versus PAD, we look at the 2020 prevalence of COVID, 20 million, PAD, 21 million. Now, COVID prevalence may actually be higher than that. This was the June CDC estimate. Look at the mortality, though. COVID pandemic, the mortality is less than 1% or less, between 0.5% and 1%. The 1-year mortality with PAD is 11%, many times higher. And if the patient has the most severe form of PAD, critical limb ischemia, mortality is almost 20% at 1 year. And yet we have absolutely no publicity on this PAD pandemic. Now, we have multiple stories about COVID every day. There's at least 5 or 6 stories in whatever media you look at. We talk about prevalence, diagnostics. We're educated on preventive measures, treatments, outcomes, vaccines, health disparities, et cetera, et cetera. And I'm not saying this is wrong. This is an important way to educate the consumer. But what we need is some type of publicity like this about PAD. If PAD and CLI had even a fraction of this media coverage that is given to COVID, we would have a much better knowledge and awareness of the disease. We'd have improved patient outcomes, and we would have lower economic costs because of their earlier diagnosis and treatment. So again, the Way to My Heart and other organizations need to somehow bring about greater media coverage of this disease. With that, I will say thank you. Once again, thank you for the Achievement Award. And these are 2 of my assistants. Thank you.
Mary is literally one of the most sought after speakers at every single physician conference around the world where vascular specialists are looking to learn. Her research is the most quoted and cited all over the world. And Mary, you've devoted your life to helping improve patient outcomes with this. You were at the forefront before peripheral artery disease was even on the radar at all. You helped to put it there. I really believe you were a catalyst for that. And we appreciate you so much. You are so deserving. Thank you so much.